A very good evening to all our viewers. This is Dr. Anjana here, your host for this evening, and welcome to another very interesting and insightful series of this podcast. So, it gives me immense pleasure to welcome yet another very interesting personality. This is Dr. Archana P. She is a practicing physiotherapist with over a decade of clinical practice and over 7 years of academic experience. She has completed her bachelor's and master's from Kempegowda Institute of Medical Sciences, Bengaluru. And during her master's, she also secured an eighth rank from the Rajiv Gandhi University of Health Sciences. Along with her clinical practice, she is currently working as an assistant professor in the Department of Musculoskeletal Physiotherapy in the reputed RV College of Physiotherapy, Bangalore. She has published 3 articles in various reputed journals, and currently she is working on 5 more research papers. She is also a guide for postgraduate students. So, with a blend of her clinical and academic expertise, she'll bring a wealth of knowledge to the table. I'm sure we are going to have a very enlightening session with on various aspects of physiotherapy with Dr. Archana. And it is a proud moment for me to also share that Dr. Archana is also my sister. So it is going to be one of a kind of session today. So without wasting any further time, let's welcome Dr. Archana for this session. Archana, a very warm welcome to you this evening.
Thank you, Dr. Anjana. Thank you for Coach Minister for giving me an opportunity to share my experience, my journey of physiotherapy, which is ongoing with you all. Thank you for the day.
Okay, so today's topic will be, discussing about various aspects of physiotherapy. So first, I would like to start off by asking you as to why did you choose this field? Why physiotherapy?
Why physiotherapy? Yeah. So I think this is one of the most commonest questions most of everyone ask a person who has joined a new career or so. So yeah, to be very frank, as you all know, medical field is a field wherein we can help the society, and it is very experimental, wherein we can help the society and do good to the society. So basically, during my plus two, as shared by the host, Dr. Anjana, she was studying her dentistry. So, and even I was interested in biology. So, seeing her study with different subjects of anatomy, physiology, biochemistry, and so on and so forth, even I found an interest towards medical field. And I thought, yes, even I can do something in this field. And when I started my research and started reading articles, I found physiotherapy a profession wherein I was not much aware of it, but yes, I did start doing the research, what exactly it is, how is it going, and what is the future of this course and all. Then I finally did few research and landed up joining physiotherapy course, which is a very interesting one.
Okay, so here I would like to add because we both sisters initially we always wanted to get into medical field. So I think once I joined dentistry, she was definitely inclined into it was inclined into a medical field, but she chose physiotherapy. So hats off to you, and you have been doing great in this field. So yeah, the coming to the next question. You have been a rank holder. I mean, that is a very pride moment for all of us. In your masters, you secured eighth rank. So beyond this academics, how do you describe your overall student experience in your bachelor's?
Okay, yeah. So as informed, yes, I got into the course of physiotherapy. I got into the world of physiotherapy. I joined Kim, which is about 5 to 6 kilometers from my home. I joined there, went into the campus. Yes, a huge campus, which had a huge hospital and a very good setup. And yes, to be very frank, I was a cocoon. I was a cocoon in entire my bachelor's life. Okay, wherein completely not having much of social life or not much of what do you say interactions with the peers or with the faculties. Yes, I was just concentrated on my studies. Yes, I've come to do physiotherapy. Yes, yes, concentrate on that. So yes, not much of interactions, but yes, that was the life of bachelors, wherein I was not into much of social life. But yes, coming to as the day passes on, I finished with my 4 years of bachelor's life and then came to internship, which is about 6 months. I think internship is the best part, wherein a particular person or a student's life, that is the best part, wherein they're going to completely interact with the patients. That is
Correct, correct.
the whole sole duty, responsibility, wherein that is what you actually do throughout your life, okay,
Hmm.
which is a very important role. So that is when I actually got to know, or I learned rather, how important communication is.
Right, right. Hmm.
Yeah. So how important the communication is, and how important, yes, the social life is. So that is when, yes, I started mingling with people. I started talking to people. I started hearing to people, because that is again very important part of our profession, wherein we have to listen, right? So we have to listen to the patient. That is when you can actually do the best to them.
Correct.
So that was my bachelor's life and internship, wherein during internship, that 6 months actually has done a lot to my profession, of my starting initial days of my physiotherapy profession, for sure.
Amazing.
Then joined my master's in the same institution, wherein, yes, that was a wonderful experience, wherein it was very good in terms of academics, extracurricular, and fun, enjoyment. Yes, that was very good.
I
That was
think,
my
yeah, I can fairly say that maybe what all you missed in your bachelor's, I think you compensated
yes,
for that in
yes,
your master's,
definitely,
right?
definitely,
Yeah.
definitely. The 2 years,
Oh,
I think I have enjoyed to the max, with respect to learning, and with respect to communication, and with respect to the other curricular stuff. Yes,
okay. So enjoyment and studies definitely go hand in hand when you're
hand
in
in hand.
college, and
Yes,
that
yes,
that that is, I think, the best part of the college life, right?
yes, yes.
So yeah. Now coming to your role as an academician. So according to you, what skills and interests make someone a good fit for physiotherapy?
Skills and interest. See, first of all, I would talk about interest. If you don't have an interest or inclination towards the medical field, or towards, I have been into academic field from past 7+ years. Okay, so I
Correct.
have seen, and I'm as the coordinator. I've been there for first year bachelor's of physiotherapy program. So that is the where the students are still in that college life of PUC, or school life of 10th standard. That the mindset is still there. Okay.
Correct.
So once they enter into this level of first year, they're still, I think, a small kids to physiotherapy
Hmm.
profession. They're just putting their first step towards the physiotherapy profession. Okay. They're
Correct.
slightly still unknown about the field. So they just say that, yes, ma'am, we are interested in biology. We found that it is found to be interesting, or we had my relative who had an injury or an illness, because of which they have taken a physiotherapy. So I thought, okay, even I can do this profession and help people.
Right. Right.
So that interest in nowadays, that is the thing which is very important. Inclination towards biology and the medical field, and for the society, some benefit to the society. So that interest and inclination will definitely make you a good physio. And coming to the skills, yes, skills. What I would say is, it's an ongoing process. It's
Correct.
not going to end on a single day, right?
Right.
So you start your career with the first year bachelor of physiotherapy. You finish your bachelor's, you finish your master's. You can further do many courses along with that, sub courses, or side courses for your physiotherapy, and you start seeing cases. And every
Right.
day your skill improves.
Hmm.
I can't say, even with 10 plus, 13+ years of experience, I can't say, okay, I'm completely skilled. No, even till
No.
date, I keep updating my skills, and that is
Correct.
very equally important. So, as such, if at all you ask me for the initial level of students who are looking into a career of physiotherapy profession, I would definitely say communication. As I said
Hmm.
earlier, just a few minutes back, communication is very important, because the patient will come to you with some or the other problem. Especially the main problem will be pain.
Hmm.
Okay, so pain is the main concern wherein the patient walks to you.
Correct. Correct.
So, and they want someone to hear. In
Right.
today's era,
Absolutely.
there are no people who can hear to a person. We are all in a world of AI, moving, running ahead, right? So there are no people who can hear and sit and hear to your problems.
Hmm.
A
Very true.
person walks to your department with some sort of pain. It could be a physical pain, it could be a particular involvement of a body part pain, but there will be some amount of psychological pain also.
Right.
So
Very
as
true.
a physio, we look at an holistic approach wherein not only we benefit the patient exactly treating for that particular cause, also promoting their confidence, improving their psychological or an emotional well-being. Okay,
Right.
so will be a better approach. So I would say communication and listening, right? Listening
Right.
to the patient, communication skill, and going ahead, if at all we think interpersonal relationships also plays a major role. Okay,
Right.
so you do have your peers, your faculties, your colleagues along with you. You should take everyone along with you and go. You should not go
Correct.
alone. Is what I
Correct.
have learned through my experience. Is what I'm even doing it right now. Okay,
Right.
so you should have a good rapport with your colleagues, and you should maintain that rapport and interpersonal relationships also, which will actually benefit for you and for the patients also. So yeah,
Okay.
of course,
So
and technical
I
skills also equally important. That is there.
Yeah,
That is there.
yeah. So I think in medical field, as you mentioned, it is always multidisciplinary. We will have to, take suggestions, or even, we'll have to collaborate with other specialists and work along. So definitely that is one thing that. So now, since you have mentioned a brief about physiotherapy, so I want to ask you exactly what is physiotherapy and how is it going to benefit a common man?
Okay. See, as physiotherapists or as physiotherapy as a profession, we
Right,
basically work towards the betterment of an individual in terms of their function. Okay,
right,
movement. Okay, if there is any movement problems, a person is having any discomfort or inability to basically walk or movement in a basic a general term with respect to a movement or their muscle strength or as a whole rehabilitation. Okay, we
correct.
focus on the rehabilitation part of it. We
Hmm.
basically try to normalize the function and the overall movement of a person basically. Okay, so we do
Okay.
have various streams of it, which we focus on. I think we could talk about it more.
Yeah,
Yeah.
so
So,
definitely that will be my next question, as to what are the different branches that you find in physiotherapy. So if you can
yeah.
elaborate on that.
See, we have around as you have the specializations and masters even in your medical field, we do have specializations and masters in our field as well. Okay, so the most commonest and most opted one is musculoskeletal physiotherapy, wherein that is even my journal. Okay, so wherein we work towards the orthopedic related issues. And we do
Right.
have the other branch which will focus on the neurology, that is the neurophysiotherapy, neurological
Correct.
physiotherapy, okay, which focuses on the what do you say, the stroke patients, then the Parkinson's patients, and the traumatic brain injury cases, any movement disorders. Okay, so
Hmm.
that will be focused on your neuro related physiotherapy. Then we do have something called as pediatric physiotherapy. Okay,
Okay.
wherein we treat small kids, babies, okay, who are having these developmental delays,
Hmm.
okay, any movement disorders or any complications during pregnancy which has led to any disorders for the baby. Okay,
Correct.
so that includes your pediatric physiotherapy. Then we do have what is known as a community health physiotherapy. Okay, wherein we focus on the society, which I was just mentioning. We do many camps, we do many outreach programs. Okay,
Hmm.
so wherein which will focus on the society as a whole. We do group therapies, okay, which
Right.
will help for the society. Then we do have a geriatric rehabilitation or geriatric physiotherapy
Hmm.
focusing on the aging population.
Hmm.
Okay, so that aging population, I think in nowadays they say the research basically says about 60 plus or 55 plus. We go ahead. We have more geriatric populations. About 20%, 30% of the population is geriatric population. Okay,
Correct.
so benefiting them for overall well-being, okay, a
Hmm.
comprehensive overall well-being for them, the patient is fine. I'm not saying the patient is having any problem or any pain or any discomfort. They walk into you. They just walk into you for their own well-being,
Correct, correct.
for their maintenance, right?
Right,
So in
right.
such cases, we can definitely work towards them improving their overall well-being in the terms of strength, in the terms of balance, in
Mobility
terms of,
and things
yeah,
like that.
mobility and functions. Okay, there could be some sort of functional disabilities, like a
Hmm.
normal activities of daily living. They will have some discomfort, so we can work towards that, and we can definitely improvise that. So that is again with respect to aging population. That is a geriatric physiotherapy we do have. Then we do have related to very commonest again is sports physiotherapy.
Hmm.
Okay,
I
most
think
of us would have seen. Yeah,
I think this is one of the most famous physiotherapy because having the IPL season going on, you see a lot of cricket matches and you see
yes,
people
yes,
getting
yes.
injured and you see a physiotherapist running into the field. Yeah. So I think this is more popular among the different branches. So yeah,
Yeah. So yes, that sports physiotherapy is one aspect wherein most of them opt for in nowadays in
hmm.
the recent era. Okay, which of course focus on the particular sport injury related aspects, and we do treat for that. Okay, there are many things in it. As such, it is a specialization. So
Correct.
just mention, yes, there is on-field therapies that can be given, off-field therapies and off-field training purpose, of course, improving their strength and their agility and their kinesiology. All those things can be improved. So on that basis, also we do work. So these
Correct.
are a few things wherein, and of course, there is something called as movement therapies that has been given. Okay,
Okay.
so wherein movement science is one of the recent branch that is focusing on, which we basically focus on what is known as the person's ability to walk. Okay, if there
Okay.
is any discomfort or disability, or basically there
Hmm.
is some changes that we can basically notice in a person how he basically walks, yes, of course
Right.
we do correct that. So movement science is one of the again latest branches in physiotherapy that has evolved, or it is a mainstream again.
Okay, okay. So, okay, then these are different branches that
Yeah,
are present in physiotherapy. So, coming back to, the basics of physiotherapy, like we know that anybody can join this bachelor's course after plus two, that is 12th
right,
standard or PUC
right.
second. So, how can one get into this course of physiotherapy?
See, yeah, as talking with respect to basics of joining to physiotherapy, plus two, post plus two, they have to have a PCB, that is physics, chemistry, and biology, an aggregate of about
Correct.
50%. Okay, we're going to take this
Right.
PCB as in this thing, and we're going to take it about 50% of PCB in PCB is required for joining this physiotherapy course. And yes,
Okay.
of course, we do have Rajiv Gandhi University of Health Sciences. It is the university on which physiotherapy is being enrolled for. Okay, so it is affiliated. The colleges have to be affiliated for the university, that is Rajiv Gandhi University of Health Sciences. So about 60, 70 colleges in Karnataka are there, which have been affiliated to Rajiv Gandhi University of Health Sciences. Okay, so you do have management quota and government quota. So 20% is the government quota in your 100% of the management seats, right? So and 80% is through your management, wherein PCB of 50% has been taken into consideration. That is how
So
your
they will.
bachelor's
Huh.
has been admitted to.
Okay, so but they will also be giving the NEET UG entrance. Is that what you mean to say, or there is no entrance as such for getting into
It is not
bachelor's?
mandatory. It is not
Okay,
mandatory. Yeah, we're going to take only PCB.
but
NEET
that
is
is
not
a
mandatory.
okay,
Yeah, yeah. PCB
okay,
12 plus 10 plus 2, that PCB is mandatory. NEET is not
okay,
mandatory.
okay, perfect. Then coming to masters, like now if somebody has completed their bachelor's, now after that they want to get into the masters. So then what is the course that they have to take?
There is no course as such. If at all you have completed your bachelor's, again the aggregate is 50%. You should have about 50% in your bachelor's as a whole put together, the pass percentage. Okay, there are various universities, there are various deemed universities, and of course colleges under RGHS which provide this master's program. which is about two
Correct.
years. Okay. Of course, in the fields which I just mentioned few minutes ago, you have about six fields of interest, of your interest you can definitely opt for. Okay, and there are deemed universities which will have their own entrance exams. For example, if at
Correct.
all a
Huh.
person has finished a bachelor's degree, I want to do masters in Manipal, Mahe,
Right.
okay,
Huh.
Manipal Higher Education. I want to do it in Mahe. Then, of course, they will have their own entrance exam. So,
Right.
students have to take that entrance exam, clear with an aggregate, and then get into the master's program in their particular university.
Okay.
But for with
So,
respect to
huh.
RGHS, the colleges affiliated to RGHS, yes, of course, there is no as such an entrance, but you do have the recent, current, present year, how it has been admitted for a government seat is they're going to take an aggregate of percentage in your bachelor's, and you will be opted a rank. And
Okay.
based on that rank, you will be having the college list, and upon your rank criteria, you will be selecting the colleges.
Okay. Okay. So, what I understand is the bachelor's is for 4 years of
Four and a
theories.
half years.
Yeah, and half year. That is 6 months of internship,
Internship,
right?
right, right, right.
Okay. And for masters, how long is the course for masters?
Masters is 2 years.
2 years of a course. Okay,
Yes,
so
two
totally
years.
it is 4.5 years of bachelor's, and then two
And
years of
2 years of
masters.
masters. Yeah.
Okay, so now if somebody wants to, dwell deeper, so what next? I mean, is there an option of doing a PhD in physiotherapy, and how about other things that anybody can do post masters?
Postmasters, yes. Talking with respect to India, postmasters, what happens is how the present situation or the current scenario is. We do have in multiple courses that are going on. See, even in masters, you do specialize in musculoskeletal physiotherapy, for example. Okay, but
Hmm.
you do have separate courses for each and every techniques that you basically apply.
Right. Okay.
So if at all you have to be super specialized, right?
Yeah. Right.
So
Right.
yeah, so super specialized. Then of course you can definitely opt for those courses and do those courses adjuvantly along with your masters or post masters. You can definitely do that. There are all
Okay.
certification courses available for a particular area of interest. Okay, they do the certification courses and they basically keep on upgrading their skills.
Correct. Correct.
Okay, so that is postmasters. And coming to PhD, yes, PhD is of course there, as which is there for all other courses. PhD is also there in physiotherapy. Of course, of their interest, PhD can be done, which is about again for 5 years, 3 to 5 years.
Okay, okay.
Yeah.
Perfect then. So this is the course which a student can take right from bachelor's till PhD, right?
Yes. Yes.
Okay. How do you, like you were mentioning about the different courses? I mean, so the students, how can they be updated once they have completed their masters? So you were mentioning about different courses and all that. So if you can brief a bit more on that.
Yeah. See, we in our college itself, we do opt and something called as we do career conclave.
Right,
Okay, so we do something called as career conclave, wherein we talk about the job opportunities also. We talk about further courses or something that has been related also.
right,
Okay,
right,
so coming to the courses, how they get to know? Of course, we do have many groups wherein there will
right.
be posts that have been put that these are the courses that are available. Of course, there is social media which is on boom right now. So you do have many posts that have been put in the social media which says yes, these courses are available in this part of the city or this part of the state. In particular, India here and there, it has been available. It is of course it is through the social media. Most of the platforms through social media itself, we do have that spread of word regarding the courses.
Correct,
Okay.
correct.
And of course, the connections and
Yeah,
what do you say? Yeah.
I think
So
I was about to say that networking, I think, was something which
networking.
is
Yes, of course.
very important. Yeah.
Networking.
So
Networking
huh,
is the key. Networking is the
huh,
key for success. Yeah. So that holds good here as well. Okay.
yeah,
So it equally plays an important role. And of course, along with the social media and networking and knowing people and talking to people more, yes, of course, you will get to know.
right,
It
right.
is
So
not a
let's,
difficult part at all in current
huh,
situation wherein okay, this course is going on here. I don't know. No, that is impossible. You will be knowing
right,
because that is how the social media is. That is how the people are basically.
yeah, Yeah. So, and also, I think talking to your peers, talking to your seniors, the ones who have cleared and
Yes,
they're practicing currently. I think if you stay in touch with them, they will definitely help you out in different courses and helping
definitely,
you stay
definitely.
updated, right? Yeah. So
True.
that holds good for I think all branches. So
Very
let's
true.
just come back to your stint as a teacher.
Mm-hmm.
So you have been in the academic field for more than 7 years now. So how has your experience been so far in
As
this
a
academic
teacher,
field?
yeah. As a teacher, yes, of course, it's a wonderful experience, and it's a huge responsible career, is what I feel.
Yes, very true.
Because you are responsible for a person's career. I am responsible for my student's career, the way my student will look into physiotherapy profession and how he basically handles his patients and how he basically comes up with all wonderful positive stays for his profession. It all depends on me how I teach and how I basically pursue myself. Okay.
Correct.
So as a teacher, yes, as I said, every day is a learning experience. Every day. 7 years back when I joined the physiotherapy profession as a teacher, the students were, and today the first year students are completely different. They're Gen Z.
Ah, right, right,
Yeah,
right.
yeah. So Gen Z people are slightly different. The thought process of those individuals are slightly different.
Okay,
So it will be our responsibility to actually be with them, okay, and act according to their needs, okay,
right,
and then help them out.
right.
So yes,
So
as a teacher, it
yeah,
is always a learning experience for me as well. But it is very, very good.
yeah, okay. It should be truly rewarding. I mean, here I would like to mention that our mother was also, a teacher, and she was a principal of a government school, and I think that is in
Yes.
our blood.
Also inspiration. Yes,
Yeah,
yes, yes. Of
yeah.
course.
So that is
That is
definitely
also
one part of it. So definitely, when you mentioned about Gen Z, I mean, I want to ask you here. You have been a student and now you're a teacher, right?
mm.
So, what is the difference that you see in the college life when you were a student and now when you are a teacher?
As I said, I was a cocoon. I was a
Yeah,
cocoon.
yeah,
Okay. So I was into my own self.
yeah,
So, but now people are not into their own self.
yeah.
They're into more into the outside world and outside life, right? So nowadays, as I said, the Gen Z students, they're more. They basically go deeper in thinking also, and they are more interactive. They
Correct.
have a
Huh,
very, very excellent communication skills.
huh,
They follow with their peers and faculties very, very nicely. They
correct.
do not hesitate to ask questions. In
Huh,
our I would not say generation, but yeah, in our time, we used to hesitate, to ask questions. Okay, can I ask whether this question is a good question or a bad question? Whether this question, if at all I ask, whether they'll think that I'm dumb or so.
exactly. I know that I can
So
relate to very
that
much.
that was
Yeah.
the thing when we were studying, we were thinking of. But
Hmm,
now
hmm.
the newer generation, they don't think. They think, yes, I have this doubt, I have to clarify this doubt.
I think which is
Whether
a
it is,
positive side. I mean,
it
which
is
is
this.
really good.
That's what. It is a very nice thing, actually. They
Yeah.
they do come and approach rather than approaching when we are teaching. They stop us and they basically ask, okay, ma'am, I didn't understand this concept. Can you please explain it again? Right?
Hmm.
So that is a very nice thing, actually. So
And
actually,
I,
with that
huh.
interaction of one to one, they learn more, and even we teach them better.
Yeah, and I think it is also possible because of teachers like you who are more approachable and who are more open to questions. Because I still remember when during my college days, during my BDS graduation days, we had a few professors who were like really not into questions. They were like, "This is
Mhm.
really simple. I mean, you need to know this." That was their concept. So I think even the staff being more approachable and more friendly with the students adds a lot, and it definitely helps the
It adds a
students.
lot.
Yeah, it does definitely helps the student also to come and approach you guys and clarify their doubts, and it
Yeah,
is
yeah. We
definitely,
also, yeah, please.
yeah, it is definitely for the betterment of the final student, and also in the end it is basically to help a patient. So I think that way it should
Right.
definitely, yeah.
We do
So
have a mentorship program which is
Okay.
ongoing. Okay, so which will help the students to talk to their particular faculties
Right.
and express their difficulties or
Hmm.
concerns which they are experiencing. And
Hmm.
one to one, the faculties, respective faculties, are going to basically help them. Okay, so
Correct.
this mentorship is there throughout in the course which we
Hmm.
follow. Okay,
Hmm.
so that is also a very positive side of the course, wherein that is actually required. As I said, students here in this particular Gen Z are not only very approaching and very active people, but also there are many people who are into these who might require an emotional well-being factors also. Okay, so this
Right.
mentorship program will actually help them out.
Right, right. Okay, perfect. Now, let us just slightly deviate and concentrate on your clinical experience. I mean, you have been a practicing physiotherapist now for more than 10 years. So, how has your clinical experience been?
Clinical experience, to be very frank, started with the scratch from bachelor's program. As I said, the internship, which
Correct.
was the time wherein I started an interaction with the patient and started seeing the cases,
Right,
started seeing the patient and treating them
right,
and getting a positive feedback and
right.
getting a positive what do you say positive response from their side for the treatment that I had given.
Huh.
Okay, so yes, starting from there till now, wherein we do have different career options in this physiotherapy. Okay, wherein we can take up, for example, freelancing and also some part of the time of my this thing also career also I was doing a freelancing thing, wherein doing visiting patients who are not
Correct.
able to approach to your clinic or the department or the hospitals.
Hmm,
Okay,
hmm.
so starting from there till now, with 10 years, I would definitely say it has been a great experience. I have learned from many patients. And of course, what I would definitely suggest to all viewers who are, especially the students who are willing to take part as a physiotherapy profession, I would say that definitely please have patience.
Right.
Okay, patience is the key again, because you have to listen to the patient, you have to give the treatment approach, and for the treatment to work and show results, it will take
Hmm.
time.
Right, right, right.
And some or the other point of time, patient might feel what do you say? They might feel irritated, frustrated that there are no results seen, that there is no improvement that has been seen. I am the same the day one and day 10 or so. What is this? What is happening? So it is you who are going to basically respond to the patient, give a positive response to the patient, and improve their confidence and improve their what do you say? The confidence and help them basically to attain what is being expected to attain. Okay,
Right.
so that patience also is very equally important. And have a good rapport with your patient. Explain, the patient walks into you, please do explain what is the um, outcome that the patient can basically expect
Huh.
from the treatment. Okay,
Hmm.
so that is equally important. So please don't keep any blind hopes for the don't give any blind hopes for the patient. Okay, this is
Hmm.
the scenario. It could take so many days, or it could basically you might have these are the difficulties that you might have. So please explain to the patient, please talk to the patient, communicate properly to the patient, and explain and tell what you're going to basically do and what is that you're doing. So even they should be aware of what you're exactly doing. So
Correct.
all the informations you give to the patient, I think with that initial level of communication that you do with the patient will actually have a good uh,
I think you
basis
gain confidence from the.
for the therapist.
Hmm.
Okay,
Hmm.
for the therapist, the patient will have a good confidence. So that is
Hmm.
equally important. So that that belief or the belief will
Hmm.
come into picture. Okay, and they will start automatically seeing results in a positive way.
Correct, right, right. When you so there is a very minor, or I don't know if I have to say major misconception in physiotherapy that physiotherapy is not for girls. I mean, I've heard this quite a few times, frankly
Mhm.
speaking. So, what is your take on that?
I think you know my take on that.
Yeah,
It's definitely a
but for our
no, okay?
viewers,
It's definitely a no, because I feel 70 to 80% of physiotherapy profession is filled with the women, okay? The females,
okay,
the
that's
women,
amazing. Okay, I didn't know
okay?
about this
And
percentage. Okay,
Yeah, about 70% at least. Even the admissions that has been happening in the present scenario, it is 70%, 80%. It is girls who are taking more admission into physiotherapy profession, and it is 20% of men or the boys basically. Okay,
Okay.
we are the best. We can do the best. Okay, so we are doing the best. So
Okay.
nowhere less. So yes.
Okay, amazing. Now that you mentioned different career options, after your physiotherapy course. So if you can just, you've briefly mentioned about it, but if you can elaborate on that a little bit more.
Yeah, yeah. So once a student basically finishes the bachelor's, BPT is Bachelor of Physiotherapy. Okay, so finishes the 4.5 years of BPT degree. They
Right,
can. There are numerous ways. Okay, in which they can start their career. They can start working. Okay, so one of course will be a clinical experience wherein they either open up their private setup, or they basically go into the hospital setup. Okay, or they basically get into any community setup scams or so with a particular agencies, and they go ahead. That is a clinical part of it. Okay, they
right,
can come into academics also, but with the bachelor's it has not been valid. They have to do a 2 years of master's program to be an academician. Okay, or to basically join an institution as a
correct,
teacher. So masters
right,
is mandatory. Okay, so they can come into the academic field by this manner of finishing bachelor's and master's program. And of course, as I said, freelancing,
hmm.
wherein they open their own setup and start doing visits. Okay, to treat patients. So
So they go
clinical
for
part
home
is there.
visits basically.
Yeah, they go for home visits. Okay,
Hmm.
so that aspect is there. Many of them opt for this. Okay,
Hmm.
so because as I said, the geriatric population is increasing day by day. They
Correct,
are they do not have anyone to get them to the department. That is one thing. The second thing is they are not able to.
correct,
Okay. So in such cases, this home visits concept of freelancing, wherein the therapist visits the patient at home, is a major plus point that is there nowadays. Okay.
correct,
So that is
correct,
also most of the people opt for this, wherein they
right.
opt for this freelancing sort of career. Okay. So
Okay.
clinical part, of course, you have all hospitals wherein there is a physiotherapy department that has been set. You see your
Hmm.
inpatients, outpatients with various conditions, be it any musculoskeletal, that is ortho-related conditions, okay, or neuro-related, all journal which I just mentioned. Everywhere we
Hmm.
have that. So all
Hmm.
hospitals, most of the hospitals, nursing homes have this physiotherapy department. Okay, so that will be a clinical therapist or a clinical physiotherapist. And coming to the academics, of course, you'll be a teacher. Okay, and then you do have a freelancing one. So these are the
Right.
few career options, if at all you're there in India, to opt for.
Right. Now that you mention, so this is the options that is available in India. Now, what are the options that are available abroad? Like if anybody has done their bachelor's or they've completed even their master's and they want to settle in a, settle abroad or start their career in some other country, then what are the options that they have? If you can just say a brief on that.
Okay, okay. See, as I said, two ways you can do this. Okay,
Hmm.
so you finish the bachelor's program in India, you can go for the master programs in abroad, or
Hmm.
both bachelor's and masters, you can go for the work experience there in abroad.
Correct.
Okay, so once you finish your bachelor's, there are master's programs that are there in abroad. Most commonly or most opted countries are USA, Canada. Then you do have what is known as Australia, okay, New Zealand. Then
Okay.
next it is Dubai and Germany. Okay,
Okay.
so the current scenario is Dubai and Germany, wherein Germany is more because of the geriatric population being more there. Okay, they are
Right.
having more and more opportunities, and they're giving more and more scholarships for individuals coming from the abroad to basically be a practitioner there. Okay,
Okay.
so you do have what is known as you don't have a master's in physiotherapy as such in most of the countries. You do have MSc.
Okay.
Okay, Masters of Science. Yeah, you do have MSc
Okay.
in kinesiology. They do have a particular subjects in masters. As
Right.
such, they don't have an masters in physiotherapy program. Very less. They basically super specialize as what do you know as MSc in exercise physiology, MSc in particular kinesiology. Okay, so like that, they do have options. Okay,
Okay.
and MSc in physiotherapy as such is also there. Okay,
Hmm.
in
Hmm.
UK. Okay, so
Okay.
USA, Canada, UK, Australia, these are the first top order on which the students opt for the countries. And most commonly, especially for USA and Canada, you have to clear the license exam. Okay,
Correct. Huh.
so USA, of course, you should have to clear a license exam. Okay, and you should you should become a registered licensed practitioners from that particular community there. Okay,
Okay. Okay.
and you can start practicing. So, and of
Okay.
course, they would look at the communication skills, as I said. So, they look for either IELTS or TOEFL, which is mandatory for them. Okay,
Hmm.
IELTS of about a bandwidth of about 6 to 6.5 is mandatory, not below that,
Hmm.
and
Hmm.
TOEFL also about 80. Okay, that is
Hmm.
what we want to expect. So,
Hmm.
for the physiotherapy profession. Okay,
Hmm.
so
Hmm.
most common universities in USA which provides these master's programs, post graduation programs, and even DPT, that is Doctorate of Physical Therapy, is also the 1 year course that has been offered by these USA and Canada people. Most common university that is most opted is your Loma Linda University in USA. Okay,
Okay.
so which is most of the Indians are there. Okay, so
Okay.
who have opted for this course, and if at all bachelors they have done, they're going to do the masters of 2 years in Loma Linda, and if at all you have finished the masters and you have gone for USA, they opt for what is known as DPT. Okay, and DPT is also mandatory if at all you have to work there in USA. Doctorate of
Okay.
Physical Therapy, it has been called as. It is a 1 year
Hmm.
course. It is mandatory if at all you have to work as a physiotherapist. If at all you have
Okay.
to work as an assistant physiotherapist, then post graduation is suffice.
Okay.
It's
Okay.
sufficient. Okay. So
Okay.
as a
Okay.
physiotherapist, you have to work wherein you don't work under anyone. Basically, you're not an assistant.
Hmm.
You are a therapist. Then yes, DPT
Hmm.
is mandatory. Same thing
Hmm.
holds good even in Canada. Also, there is
Hmm.
University of Alberta, University of Ottawa, which is very famous. Okay. Which again holds good. The same admission process. Everything is the same. You do have to apply. You do have to get the credit scores. Okay, which is there. According to our university, we will have certain credit scores, 60, 120 credit codes. And if at all it
Right.
is not been matching, you will have, or you will basically take 1 year of experience here in India. That will also be counted. It will be added up to your credit scores, and then you're going to further
Hmm.
go ahead with your working or post graduation.
Right. Okay.
So
So,
that is how it is. And the current trend, even in Dubai, you have to clear. There is something called as DHA, okay, Dubai Health
okay.
Authority examination, okay, wherein you have to clear that exam, and you can opt for being a licensed practitioner in Dubai. So Dubai and Germany are the current trends that is going on. And yes,
Okay.
Australia is majorly which is concerned for sports.
Sports physiotherapy. Right.
Yeah, yeah.
Yeah, okay. So that I think is a very nice brief of different countries, and if students are listening to it, I'm sure this part they would have loved it, because if somebody wants to, have their career and migrate and have their career in different countries, you've given a wonderful brief of different countries. Okay, perfect. Now, so once this is done, what do you think? I mean, we now know that there is a lot of technology that is being used in different fields of medicine. So how do you think technology has influenced this field of physiotherapy, and what do you
AI
feel? I mean,
basically.
AI, yeah, exactly, AI. I think that is the buzzword now, yeah. So AI, so how has that transformed physiotherapy according to you?
See, technology will definitely help people to improvise their skills, but
Right.
it is not man. It is man-made. Okay,
Huh.
so what I would say is, see, because of this technology, of course, because of the science, because of the AI, we have, as you know, even in our physiotherapy field, we do have anatomy, physiology, biochemistry, so on and so forth. We do have many techniques that we follow to basically do on a patient. Okay,
Correct.
so with the help of this AI, with the help of robotics, with the help of the technology and the science, we have developed many videos are there. Okay, many models of the joints are there. Okay, and many videos of techniques, demonstrations, how it has to be done, how it can be further improvised. You have many exercise prescriptions that are available on social media. So yes, of course, it has been benefited, and of course, as I said, the movement science, which I just mentioned in my initial talk.
Yeah,
wherein
yeah.
we said that that is the newest thing that is focusing on the movement science, that is how a patient basically walk, the analysis part of it, okay, or the
Mm,
assessment
mm,
part of it. So with
mm,
the help of technology, with the help of science, with the help of these applications or the apps, what we
mm,
call, it
mm,
is found to be very, very beneficial. It is
mm.
basically helping the medical professionals or us to basically improvise our um,
Precision
assessment
in
performance, yeah,
diagnosis. Yeah.
assessment
Huh.
performer, and
Correct.
helping us to basically confine to a proper diagnosis or so. But
True.
yes, of course, it is helpful for your assessment, putting up the treatment protocols, setting up the goals, and setting up the exercise prescriptions, providing the exercise prescriptions to the patients. Okay,
Right.
providing them videos so that they do not forget and they can basically play and again remember, recall, and perform and practice those exercises. Yes, of course, it is definitely beneficial. But at the end of the day, all these AI are there, which is supporting us or helping us.
Correct.
Okay,
Correct.
but we as a therapist we can never be replaced by any AI.
Huh.
Okay, because our hands-on techniques and skills are still there with us. It has not been taken up by AI or any technology. Okay, so we are still there and we will be there, putting forward our skills and hands-on training to the patients, which is more beneficial than these assistive technologies. Of course,
So
as
I
I
think,
said, we
huh.
will actually do these therapies, treatments, and to assist us, to help us, support us. Yes, it is there.
Yes, so I think going along with technology, but being your physical presence and your communication with the patient
Yes,
is what matters the most. Right.
yes.
I think we are coming towards the end of this podcast session. So I would like to ask you, what are your future aspirations in your career? Like, how do you see yourself in another next few years?
Yes, lot of things lined up actually.
Okay.
Planning to do my doctorate. So that is what I am looking into more. Influence into research, because that plays a major role further going ahead. Okay,
True. Very true.
we do research. I think we can learn a lot of things and we can get to know many things. Okay,
Correct.
so I am focusing more on my research related activities,
Hmm.
more of studies and papers, and learning more and more techniques. I have
Correct.
just thought I'm going to further super specialize, as I said, in a particular area of my interest. Okay, and do a good social service to the society.
All
That is
right.
what is
I,
the end thing and end this thing which I will definitely
I
have a
think,
satisfaction in.
yeah, I think we all doctors strive for that. Patient satisfaction is what we all
Yes,
strive for. So yeah,
yes.
amazing. So all the best for that. And your last piece of advice for students who are currently planning to opt for physiotherapy in the coming future. So what would your advice be to all those young students who are listening to you now?
Students, get up, go going. World is waiting for you. Okay, keep moving, keep your patience moving, and keep up the spirit. And yes, the world is
Amazing.
waiting for you. Please go ahead.
All the best. Okay, amazing. That was like one of the best things that I've heard. So thank you so much, Dr. Archana. And it has been a pleasure talking to you, and it has been a proud moment for me personally speaking to you on this platform. So I would like to
Same
also
here.
thank Coach Minister for this. So
Yeah.
I guess all students have had an amazing, insightful session today. Thanks for being with us. Thank you, everyone. So good day. Bye.
Thank you so much, Coach Minister, for giving me an opportunity. Yes, thank you, Dr. Anjana.
Yeah,
Thank you.
good day. Good day.
Good day.
Bye.
Thank you.